Yes, can you just take a minute and talk about the high number of negative tests? According to yesterday's count, it looks like it's about 91% of people who were tested are coming back negative. If I'm to understand this, we're limiting the testing to people who have either traveled from the hot zones, are exposed to people who are positive, and people who have symptoms. Of all of the 7,000 people, are they false negatives? Did they have the flu and just didn't get flu shots? And are they going to be retested over some period amount of time, in another week or so or something, to make sure that they're actually negative? How does that work?
So first off, a brief comment about testing. We have recommended from the Public Health Agency people that we believe absolutely should be tested if they're symptomatic, right? We're testing primarily asymptomatic people, and this is consistent with guidance that the CDC has put out, consistent with guidance from other states around who we believe absolutely should be tested, who should be prioritized for testing. The decision on testing other people is up to the discretion of a healthcare provider, assessing their patient based on the patient's symptoms, other medical conditions they may have, their ability to isolate at home, whether they may be more vulnerable to complications of COVID-19. So anybody that is having symptoms and concern they may have COVID-19, we encourage them and actually request that they call their healthcare provider, because the healthcare provider really is the one that's making the decision about testing. We have highlighted certain groups from the public health perspective that we believe should be tested, with the understanding that there's another large population that can be considered for testing if supplies on the ground at the local community level permit that. Your question about the accuracy, I think, your question pertains, I think, to the accuracy of the testing that's out there right now. The testing that's currently conducted is what we call a PCR-based test. It's looking for the genetic material of the virus itself, and we do that by inserting special swabs into the nasal passage to try and then detect and amplify the genetic material of the virus. Those tests, we believe, are very sensitive at picking up the virus. So if someone is showing symptoms of infection, we believe that the virus is able to be shed very early, be able to be found in the respiratory tract very early in the course of illness. And so the test should be sensitive at picking up infection if it's there. Now, there are many other reasons someone could have symptoms of COVID-19. There are many other viruses that are out there. Influenza is still circulating, although the levels of influenza are dropping. So not everybody with symptoms of COVID-19 will necessarily have COVID-19. But given the rapid spread and the ease with which this virus is spread, if someone is unable to get testing or a provider thinks it's most appropriate to manage somebody with symptoms at home because they're otherwise healthy, they're not seriously ill and not otherwise in need of medical attention, if someone is able to be managed at home, a provider may appropriately recommend that person not need testing but be managed at home as if they have COVID-19, and we certainly support providers in doing that.
Are there any other reasons of the, more than 7,000 out of 8,500 seems like a lot to me. I don't know. I'm not a scientist, so.
So it's hard for me to speak to the exact numbers and why somebody tests negative versus positive at a population level. What I will say is that we believe when someone who's symptomatic tests negative, that indicates the person is likely not infected with COVID-19. What I can also say is that people have asked about negative testing if someone is asymptomatic, and we don't routinely recommend testing of people that don't have symptoms because testing people that don't have symptoms doesn't necessarily mean that they won't then go on to develop infection. And so, negative tests in people who are asymptomatic, meaning without symptoms, need to be interpreted with caution. But if someone is symptomatic and they have a negative test, we believe that is a pretty good indication that they likely don't have COVID-19.